In today's topic, we are going to discuss about the CSF. At first, we are going to discuss about the normal composition of CSF. It consists of the protein 20 to 40 mg per 100 ml of CSF, glucose 45 to 80 mg of 100 ml of CSF, chloride 720 to 750 mg per 100 ml of CSF, and other substances like sodium, potassium, bicarbonate, and urea are present. Now, at first, we are going to discover the formation of CSF. The CSF is formed through the filtration and secretion at the choroid plexus. What is choroid plexus? The choroid plexus are the collections of the pyometric collateral vessels plus the ependymal cells. Choroid plexus here. Choroid plexus is mainly made of pyometer collateral vessels and ependymal cells. Ependymal cells line the ventricles, which is filled of CSF. Here, the pyometer and collateral is known as the tela choroidea, and these three structures are known as the choroidal plexus. From here, CSF is formed, and later, now we are going to discover the circulation of CSF. Circulation of CSF from this figure we can easily understand. Here, at first, CSF is formed from the choroidal plexus in the lateral ventricle. Suppose this is the choroidal plexus, and this is lateral ventricle. At first, CSF is formed in the lateral ventricle, and it later drain into the third ventricle. This is the third ventricle through the foramen of Monro. This is foramen of Monro. Then third ventricle, and later continued and connected with the fourth ventricle through the cerebral aqueduct, which is situated in the midbrain. This portion is known as the midbrain, and continue at the fourth ventricle, which is situated just 50% in the pons and 50% in the medulla. Here in the fourth ventricle, there are three openings that are known as the foramen of Lusca, which are situated laterally, and in the center medially there is one opening known as the foramen of Magendie. From here, the CSF drain and later pass to the subarachnoid space, which is situated just outside here. Later pass to the subarachnoid space, and from there it passes to the superior sagittal sinus, which is situated here, just here, superior sagittal sinus, which is drained through the arachnoid villi. Now here, at first it is formed in the lateral ventricle, which passes through the interventricular foramen of Monro, and then third ventricle, then aqueduct and fourth ventricle. Here, from the fourth ventricle, foramen of Lusca and Magendie to the subarachnoid cistern. This cistern are nothing; it is just the dilated part of the subarachnoid space, and then it can also pass downward through the central canal of the spinal cord. Now, how is CSF absorbed? We have already discussed in this figure. In the superior sagittal sinus, which is situated upward of the cerebral hemisphere, through the arachnoid villi, the CSF is absorbed, and the drainage through this arachnoid villi maintain the hydrostatic pressure of the CSF. And what is the pressure of CSF? The pressure of CSF is normally 70 to 180 mm of water in supine position. We should also mention the position, and it increases in the case of meningitis and hydrocephalus. Now, the function of CSF. The function of CSF. The CSF mainly protect the brain from injury through outer covering, and the specific criteria of CSF is same as the brain, so it provides the buoyancy, and it also has to remove the 5-hydroxytryptophan. Tryptophan means serotonin, adrenaline, or the drug from the brain. It also provides the extra space for the brain swelling, and it also provides the nutrition to the CSF. Now, one small topic remaining is lumbar puncture. Here, the lumbar puncture is done mainly lumbar puncture is done mainly in the between the third or fourth lumbar vertebra, or fourth and fifth lumbar vertebra. Spinal cord is end up to the below the level of the first lumbar vertebra, so we can do the lumbar puncture from the third to interspace between the third and fourth lumbar vertebra, or fourth and fifth lumbar vertebra. Here, we should pierce the few structure from outer to inward. I am going to list that structure. There is skin, subcutaneous tissue, and ligament. There, first one is the supraspinous ligament, then interspinous ligament, then ligamentum flava, then epidural space, which is situated just above the dura mater, then dura mater, then subdural space situated below the dura mater, and then arachnoid mater, and in last subarachnoid space where CSF is present. Thank you.